Recently, federal partners launched an updated action plan for the prevention, care, and treatment of viral hepatitis in the United States. The three-year renewal builds upon the nation's first comprehensive action plan to combat viral hepatitis, which was released in 2011. The updated action plan can serve as a framework for continued medical, public health, and community action. Between 3.5 and 5.3 million Americans are living with chronic viral hepatitis, and most of them don't know that they're infected. Consequently, viral hepatitis is the leading cause of liver cancer and the most common reason for liver transplantation in the United States. In addition, viral hepatitis is a leading infectious cause of death in the U.S., claiming the lives of some 12,000 to 18,000 Americans each year. The plan calls for increasing the percentage of persons whose chronic hepatitis B or C infection is diagnosed in a timely manner, reducing the number of new hepatitis C infections, and eliminating the perinatal transmission of hepatitis B. Now, in recent years, we have seen several important advances in the field of viral hepatitis, including increased public awareness of hepatitis B and C among affected populations, fueled in part by new education campaigns from the CDC, as well as the national observance of Hepatitis Testing Day on May 19th. Enhanced efforts by medical providers in hospitals and birthing centers to increase the number of infants who are vaccinated for hepatitis B at birth. A 2013 recommendation from the U.S. Preventive Services Task Force calling for one-time hepatitis C screening for all those born between 1945 and 1965. The implementation of the Affordable Care Act, which is extending quality health coverage to more individuals. New improved hepatitis C treatments that are easier to take and have cure rates as high as 90%. And in response to a proliferation of effective new Hep C treatments, professional medical societies coming together to provide real-time, user-friendly treatment guidelines. The updated plan builds on these advances as well as other accomplishments. It details more than 150 specific actions to be undertaken between 2014 and 2016 by agencies or offices from across 4 federal departments. These actions are organized around 6 priority areas. Educate healthcare providers and communities about viral hepatitis. Improve viral hepatitis diagnosis, treatment, and care. Strengthen viral hepatitis surveillance. Eliminate vaccine-preventable viral hepatitis, including perinatal transmission of Hep B. Reduce viral hepatitis associated with drug use, and protect patients and providers from healthcare-associated viral hepatitis. We recognize that federal action alone is not enough, and the plan calls upon healthcare providers, professional organizations, community groups, private industry, and other partners to lend their time and talents to confronting this pressing public health problem. Together, we can inform policymakers, train providers, educate communities, and develop model programs, all of which will reduce the terrible health consequences of undiagnosed and untreated viral hepatitis. There's no question that we can effectively fight the silent epidemic of viral hepatitis, and in so doing, save thousands of lives.